So now I will introduce our final speaker, Dr. Jane Muir from Monash University, and Jane is going to help us make sense of gluten-free, wheat-free and FODMAPs. Thank you, Jane.
Thank you, Robin, and thanks for the opportunity to speak here today. So today I'm going to try and make sense of the entity of gluten-free and wheat-free diets and introduce the idea of FODMAPs. So I thought I'd start by talking about FODMAPs and really what they are. The whole idea about FODMAPs really came to solve a clinical problem that was presenting very commonly in the clinics of gastroenterologists. So another clinical problem is irritable bowel syndrome. It's the most common reason for people being referred to as specialist gastroenterologists. In fact, 50% of their patients will end up with this diagnosis of irritable bowel syndrome. It's very common in Australia. In fact, around 15% of the population will have IBS, so it's 1 in 7 Australian adults. So it's a very common problem. And the symptoms that are characteristic of IBS include abdominal pain, abdominal bloating, wind, and alternating constipation, diarrhoea. So as far as the question of whether or not these sorts of digestive problems are on the rise in Australia, well, they're very common in Australia. Whether or not they're increasing or we're just getting better at diagnosing, it's sort of hard to say. But certainly doctors are getting much better at diagnosing this problem, and it is a very common problem. So what are the causes of IBS? There appears to be a disturbance in the gut microflora. There's possibly the presence of small intestinal overgrowth of gut bacteria, so that's bacteria that normally resides in the large bowel moving up into the small intestine. Hypersensitivity of the gut to luminal dissension, so these patients are very sensitive to changes in their gut, so expansion of the gut wall. And also, there are just well-known dietary triggers. All these patients will list foods that trigger their symptoms. What are the treatments for IBS? Treatment is always aimed at the symptoms. And the team at Monash that I'm involved with have now developed a diet therapy that is based on restricting certain carbohydrates from the diet. Now we all know that there are certain foods that we eat that will have certain carbohydrates that can cause problems in the gut for some people. Probably legumes are well known. This is not new. We've known this for a very long time. So what are the triggers in these foods? They contain short-chain carbohydrates, including galacto-oligosaccharide, or GOS, fructo-oligosaccharide, often known as FOS, and also fructans, lactose and fructose, also sugar polyols. These carbohydrates can be poorly absorbed in the small intestine, and as a consequence, they're rapidly fermentable in the gut, creating gas. Because of their small molecular size, they're very osmotically active, so they can draw water into the bowel. So the IBS symptoms really are thought to be induced by the distension of the gut and changes in gut motility. Now, short-chain carbohydrates are present in a range of foods. So the evidence for this is going back a long time as well. And it's actually in relation to IBS, there's been a lot of published information going back many years that certain sugars will induce gastrointestinal symptoms in some patients and just in healthy people. Sue Shepherd came and worked in our group about 10 years ago. She started working on this and did a PhD with our group. And I'd like to acknowledge her role in this area for starting it off. And here are some key papers there from the group, and that Sue was involved with. My role at Monash, now there's actually a very large team involved with this, over the last 7 years, is really understanding the diet, food composition, and then the evidence base for the diet. and the effectiveness in people with IBS. So what are FODMAPs? It's an umbrella term, and it basically describes the range of short-chain carbohydrates that can be poorly absorbed and rapidly fermented. It stands for fermentable oligosaccharides, which include fructans or fructooligosaccharides, and galactooligosaccharides, which are found in legumes, onions, garlic, and grains and cereals. Disaccharides, lactose. Monosaccharides, free fructose, that's fructose in excess of glucose, found in apples and pears and honey. And finally, polyols, the sugar polyol, sorbitol and mannitol, often found in stone fruits, some vegetables, and used as artificial sweeteners. So what's the mechanism by which FODMAPs work in the gut? And the evidence that we've really contributed over the last few years is we have, and I've just listed the paper there for you, we have good evidence in a study that Jackie Barrett undertook using ileostomies as a model for small intestinal digestion, just to show the effect of FODMAPs in the gut, and that was basically showing the effect of the osmotic effect of FODMAPs. And then another nice little study also published by some of my honours students actually, showing the effect of FODMAPs on gas production and symptoms in healthy and patients with IBS. So basically, what do FODMAPs do in the gut? Well, they're poorly absorbed in the small intestine. In the large intestine, because they're osmotically active, they will draw fluid into the gut, water delivery. They're fermented, get gas production. And both of these effects contribute to luminal distension, altered motility, and these contribute to the symptoms of IBS, pain, bloating, distension, wind, and alternating constipation, diarrhoea. So the LowFODMAP approach, what we do with this approach is we basically restrict foods that contain high FODMAP foods. So that is, we restrict fructose, lactose, sorbitol, mannitol, and fructans and GOS. And the reason why I've highlighted fructans and GOS there is that they are the major FODMAPs in grains and cereals and legumes. But we don't eliminate grains and cereals and legumes, we use LowFODMAP alternatives. So LowFODMAP approach, it's a complete diet, and we recommend people follow it for around 4 to 6 weeks. And patients will notice their symptoms improving within 3 to 4 days, and usually after about 7 to 10 days they've reached their maximum benefit as far as symptom control goes. Because to change the gut flora will take longer, we recommend people stay on it for about 4 weeks at least. It is a complete diet, and grains and cereals are well represented there, as well as fruits and vegetables, and they're all chosen based on their FODMAP content. And here's an example of a sample meal plan. So you see under the high FODMAP diet, for example, you might have a rye or wheat bread and honey, or wheat bix, apple juice, these are all considered high FODMAP foods, pear, mango, extra chewing gum because it contains sorbitol. Again, rye and wheat breads, we sometimes will use Coke or soda from the US because of high fructose corn syrup. You can purchase yogurts which have had FOS added to them. For a low FODMAP alternative, you'd exchange the rye and the wheat for gluten-free bread and spelt bread. You would use lactose-free milk. You would use an orange juice instead of apple juice. You can use a mandarin or orange instead of pear and mango. You can use PK chewing gum, for example, which just has sucrose and not sorbitol. So basically, you can go through and substitute. There are good substitutes for each of the high FODMAP foods. So now I'd like to talk, really trying to make sense of the gluten-free and wheat-free story. So are digestive problems on the rise in Australia, and what is this wheat and gluten intolerance? It's very difficult to get accurate figures about this, but we know we're getting better at diagnosis. What about gluten and wheat intolerance? It's predicted that over 1 million Australians purchase gluten-free products for health reasons, and this is growing. In the US, the market's growing by about 23% per annum also, so it's extremely popular. People are really choosing wheat-free and gluten-free products, and they're claiming that it does help them with their gut symptoms. So gluten-free, celiac disease versus non-celiac, gluten intolerance, and we actually have a real interest in this area in our group. We're really starting to understand this entity. It's been confusing and mystifying for us for a while as to understand why people are putting themselves on these very strict gluten-free diets. Because really they're designed to treat celiac disease, which is an autoimmune disease. And a strict gluten-free diet is the medical therapy, first-line medical therapy. It is a very strict diet and really only affects 1% of the Australian population. You wouldn't put yourself on this diet unless you really needed to for medical reasons. Now, there is another group. We call them non-celiac gluten intolerance. These are people who do not have celiac disease, but they still have gut symptoms. They feel are triggered by gluten in the diet. And I have a student, a PhD student, Jess Bersikerski, who's actually done a lot of work in this area, and she's published a little paper there, trying to understand this entity of this non-celiac gluten intolerance group. What we think is starting to happen with these people is that they really do feel better on wheat and gluten-free foods, not because of the gluten, but probably because they're selecting a low FODMAP diet, and I'll explain that a bit more with this slide. So this rather complicated slide shows you the composition of a range of grains and cereals, and you can see most grains and cereals contain fructans and GOS, which are the major FODMAPs in grains and cereals. And again, you can see you can get a wide range of levels of FODMAPs naturally occurring in these foods. We can select quite easily a low FODMAP alternatives for people who might be having a high FODMAP diet. When we superimpose on this what are gluten-free, in pink now I've shown the gluten-free products. Now, with the exception of legumes, which are gluten-free, really all the gluten-free products down this end have also been low in FODMAPs. So by selecting a gluten-free diet, people are selecting a low FODMAP diet. So their symptoms relief that they feel they're getting on the gluten-free diet is probably due to this reduction in these highly fermentable carbohydrates. It has actually little to do with gluten itself. And I can show that again here in this slide. These are actually grains, not really grain products, which you see rye has the largest amount of FODMAPs. Again, it's fructan and GOS, which are the major FODMAPs. And you can see again, when you think about which are the ones that are gluten-free, actually I'm just showing here the low FODMAP grains suitable for IBS are the ones at this end here. The gluten-free grains, in pink, again, you can see quite clearly that the low FODMAP grains are the ones that are gluten-free. So are grain-free diets a solution to digestive health and tummy bloating? We don't recommend people avoid grains at all on these diets. We recommend people switch to a low FODMAP alternative. We never say take out grains from your diet. So no, I don't believe that a grain-free diet is a solution to bloating at all. And we do not recommend that that you follow this sort of diet for long as well. There's always alternatives. And the alternatives that we often use for low FODMAP diet include oats, and rice, rice-based products, corn flour and quinoa, so you can get some very good quality low FODMAP grain alternatives. So translating this into practice, what are the key recommendations? There's a twist to this story. The role of FODMAPs in gut health. I don't want people going away from this thinking that FODMAPs are bad for you. Quite the opposite. FODMAPs are probably really essential for your gut health because the prebiotics, FOS, fructans and GOS, are FODMAPs. and you need those for their prebiotic effect. So for the majority of our population, we should actually all be having a reasonably high FODMAP diet. This is a diet which is aimed, therapeutic diet, it's aimed at managing gut symptoms associated with a diagnosed medical condition, IBS. It's not for the general population at all. And certainly for controlling IBS, we recommend just following it for 4 to 6 weeks, and then with the help of a dietitian, they gradually reintroduce foods again. So future directions. We need to understand the long-term effects of gluten-free diets and wheat-free diets, because there may be implications for gut health there. If you're taking out natural prebiotics, essentially, and there is some evidence in the literature now that people following a gluten-free diet have lower levels of probiotic bacteria. So a gluten-free diet is not a healthy diet to be on, maybe for your gut at all. We need to understand the role of the gut much more, and the role in bloating. We need to improve the quality of grains, particularly the gluten-free grains, for our people with celiac disease and for our patients who have to follow this diet for a certain period of time. And we do need special products aimed at this group. We also need to educate the public and industry about really why gluten-free products are being so popular, and we can understand really the mechanism why people are choosing these, and that will inform probably a better product out there in the industry. Okay, I think that was my last slide. Thank you.
Well, thank you very much, Jane, for helping us demystify FODMAPs and gluten-free diets.